This is Dr. Howard Strassler talking about direct placement, cusp replacement restorations as cores for crowns, and we'll be talking about using composite resin as our core material. This is OP10B, Module B on composite. And what you'll notice is when we talk about large restorations, the causes and needs for large restorations, it's the same whether we talk about cusp replacement amalgam restorations or cusp replacement composites. The same things are occurring: loss of tooth structure, restoration due to trauma, loss of tooth restoration or structure due to poor cavity design, recurrent caries, initial caries. All these are the same causes. It doesn't matter. The choice of restorative material helps guide you. The same reasons for replacement, the failures of restorations due to fracture of a restoration or fracture of a tooth, recurrent caries, initial caries, marginal breakdown. The reasons for replacement are exactly the same. When it comes down to it, when you make your decision whether to use amalgam or composite, it really is what's the best material to restore the tooth, and then what's going to be your final restoration. If your plan is to use a composite resin cement for an all-ceramic crown, then it would make better sense to use a composite resin core than amalgam. We have three choices for build-up materials: amalgam, glass ionomer, and composite resin. And amalgam requires additional retention, as you heard in OP10 Module A, the need for pins, slots, grooves, and posts. And matrix placement is much more critical, and it must be stabilized because it's an active placement technique. And before you can prepare the tooth for a crown, you've got to wait 24 hours. It's why composite resins have become more in favor. The ability for a composite to place them and prepare them the same day. Glass ionomer as core buildup material is really not a good idea because of their poor physical properties. And keep in mind, for glass ionomer to work, you need at least 50 to 60% of the tooth remaining, and you must still wait 24 hours for adhesion to develop before doing your crown preparation, but glass ionomers tend to be a very weak material when compared to amalgam and composite. Composite cores have become much more popular in the last decade. Part of it is the ability to use adhesion for retention, and that our compatible adhesives are greater than they were a decade ago. Retention with bonding is immediate, and the physical properties develop immediately upon curing, which means you can prepare and impress the same day for a crown of the tooth you've just restored. When you talk about composite resin core materials, you're really talking predominantly about two different families of composites. A self-cure composite, where you mix two pastes together, or a dual-cure composite. A dual-cure composite uses light cure and self-curing properties. As self-cure materials, you mix it together and it sets on its own. Whatever you're choosing to use, whether it be self-cure or dual-cure, it must be chemically compatible with the adhesive. Use the manufacturer's instructions and directions to tell you which adhesive to use with their self-cure or dual-cure material. Unlike light cure materials that we're placing in increments, dual-cure and self-cure materials can be placed in bulk fill, because there's no concern for polymerization shrinkage, because the crown margins will be sealed by the crown. So the discrepancies and any marginal discrepancies based upon polymerization shrinkage won't be of concern. But it still comes down to the final crown preparation design determines where and what type of retention you're placing, and what thickness you need of the restorative material when you're doing your cavity preparation for that foundation material. So let's look at the indications for core buildups. When we take a look at these clinical cases, you can see that these are teeth that are going to get crowns, that we need to consider our retention when we're placing them, and what our final restoration will be. Can we place a stable matrix? Will come into play when we look at this. And if we can't place a stable matrix, amalgam's not a good choice. What sort of auxiliary retention will we use? In this case, we have a slot that's been prepared at a line angle for whether we use composite or amalgam. And that if we have an endodontically treated tooth, as this premolar is right here, then our consideration towards placing the restorative material into the canal itself, as we see for this one as well as what will be the definitive restoration. Is there adequate tooth on facial and lingual to retain the composite or the amalgam after the crown is prepared? In this case, yes, we have plenty of tooth structure. Consider if you need crown lengthening. You need to get a ferrule design to your crown preparation extending 1 millimeter to 2 millimeters beyond the restorative material when you prepare that core. And you may need to place crowns that have some gingival procedure in order not just to get the matrix on, but to create a ferrule design in your crown preparation. Know what matrix to use, whether it be a conventional Toffelmeyer matrix band, a copper band as you see in this case, or whether you're going to use an auto matrix, a self-retaining 360-degree circumferential matrix system. When we choose composite core materials, our predominant choices are self-cure and dual cure, but don't forget, there are certain times when using a light cure will make it easier in your final restoration placement. That we have choices with composite core buildup materials in terms of what color, what shade we select from. That for most of our composites, we're using a natural tooth-colored shade that's made to match the tooth. Except for anterior tooth, where we're using translucent ceramic materials, that many times in the posterior using a colored or opaque material is better, so we can discern the difference between the margin of the tooth and the restoration so that we can be beyond that restorative margin. More on that later. Why we're using different shades? Well, we want to differentiate the color of the tooth from the composite. The ability to see the margins of the crown to make sure the preparation is entirely on sound tooth structure. And this ferrule design of the crown preparation extending at least 1 to 2 millimeters beyond the composite core, 360 degrees around the preparation. What if the crown preparation isn't on sound tooth structure? If you look at this x-ray, the distal of number 18, the margin is short of the composite. This margin is at risk for recurrent decay at a greater rate than you'd see with amalgam. Remember, this was a bulk placement composite. We had shrinkage. An amalgam in this circumstance will function much better than composite. So that we have choices in color to be able to discern that different. Here, we've placed a natural tooth-colored composite core for this maxillary first molar. Or we can use a color, and many of them have blue as our color. In fact, the Fluorocore Plus 2 Plus that we use at the clinic is blue in color, so we can discern the difference between the composite and the tooth margins when we do our crown preparation. And some companies give us an opaque composite. So once again, if you look at the lingual margins on this premolar, it's easy to tell where the composite ends and where the crown ends. So let's take a look at some cases, some basic cases of using different color composite materials, why they were used, and how we're retaining that composite within the tooth. So for this tooth, we have a large amalgam restoration with recurrent decay at the gingival margin. We can poke into the margin with an explorer. It's obvious on the radiograph. It's a vital tooth and its treatment plan for a porcelain fused to metal crown. We place the rubber dam, mesial and distal. We pre-wedge the tooth, and we remove the amalgam. So here we have the dam in place. We have the amalgam completely removed. We remove all the existing caries, and now we're ready for matrix placement. When we look at the choices for a foundation, like I said earlier, it's an amalgam with a pin or a slot or some additional retention. We can do a bonded amalgam, a light cure composite, a dual cure composite, self-cure composite. For this tooth, and by the way, this tooth could have used any of these restorative materials successfully. For this tooth, the decision was made to use Fluorocore 2 with a dual cure adhesive. Now, dual cured composite resin, or Fluorocore 2, is an auto-mixing dual cure composite resin. It has fluoride glasses within it, very minimal fluoride release, if any. It has an auto-mixing tip with an extension, so you can place it directly into the base of the cavity preparation, filling it from the inside out. Since it's dual cured, it'll self-cure in a pulp chamber of an endodontically treated tooth in the absence of light curing. Being dual cured, we can use our light to get a snap set of the outer section of the restorative material before we do our finishing and polishing. Fluorocore 2 can be placed with both an etch and rinse adhesive called Prime and Bond NT, mixed with an activator to make it dual cure, or with a self-etch material called Xeno 4, once again mixed with an activator to make it dual cure, so it bonds to the dual cure composite resin. On the left-hand side, you can see the little extension tip that we can put on the auto-mixing tip of the Fluorocore 2. This extension allows us to syringe it in the cavity preparation. We have choice of two different adhesives. Both come with a self-cure activator. Prime and Bond NT requires we etch the tooth with phosphoric acid. Xeno 4 doesn't require the use of phosphoric acid. It's a self-etch system. So we have our matrix in place. We burnish the band to achieve proximal contact. And for this case, we're using Prime and Bond NT as a dual cure, so we're mixing it with a self-cure activator. Our etchant is in the tooth completely for 15 seconds. Rinse with water for 10 seconds and dry the tooth. The same repetition of technique as we would for any composite resin. Prime and Bond NT is a 5th generation etch and rinse adhesive, phosphoric acid etching. When using the dual cure composite mix, equal drops of adhesive and activator, and you can see there's a self-cure activator that you can use with both Prime and Bond NT and Xeno 4, and it's the same activator. Xeno 4 doesn't require phosphoric acid etching. It's a self-etching adhesive. It would be used as a self-etch in the cavity preparation for 15 seconds, agitate and air thin. So the techniques for Prime and Bond NT, and you'll know that it's very similar to what you do with any composite. Etch the tooth for 15 seconds, rinse etching off the tooth with an air water spray for 10 seconds, dry the tooth, the dentin can be left slightly damp. Mix 1 to 2 drops of Prime and Bond NT with 1 to 2 drops of self-cure activator. Paint in the cavity preparation. Air thin the adhesive. Evaporate the solvent for 5 seconds. Light cure for 30 to 40. And you might say, why so long? Deep cavity preparations require additional light curing to make sure that we get the pulpal and gingival margins, especially true in pulp chambers of endodontically treated teeth. For the Xeno 4, no etch is needed, and the techniques are exactly the same. We still are light curing for 30 to 40 seconds, all for the same reason. The only change in procedure is no need to use phosphoric acid. So for this case, I've prepared the tooth, I've placed my matrix, placed my wedges. I use Prime and Bond NT, and keep in mind I've already etched the tooth for 15 seconds, rinsed and dried. I'm moisturizing the tooth with a damp cotton pellet before I place my adhesive. I mix 1 to 2 drops of the Prime and Bond NT with the self-cure activator, dual cure activator. I apply it in the cavity preparation. Notice I'm using a brush and not a micro brush. It gives me a more efficient preparation. I air thin the adhesive, and I light cure it. Here I am evaporating the adhesive before light curing. Light cure at 20 to 30 seconds. The light's at what? Right angles, as close as possible to the tooth for 20 to 30 seconds. Now we're going to use Fluorocore 2. Do I choose tooth colored, natural, or do I choose blue? Well, blue will let me see the margins better in the posterior. I'd rather choose blue. So I put on my self-mixing tip on the Fluorocore 2, and I put the extension so that I can syringe it into the box. And what you see in the right and left-hand picture is the small tip going into the proximal boxes, mesial and distal, and then filling up the cavity preparation. I'm going to slightly overfill with the blue Fluorocore 2. I'm going to use a brush wetted with the adhesive to shape it, and when I light cure it, I'm going to light cure each box for 20 to 30 seconds. So I'm going to actually place the light mesial and place the light distal to make sure I get a complete light cure of the surface. Keep in mind, if the light doesn't get anywhere, it is a dual cure material and it'll set on its own. Now the composite's finished. I'm going to finish and polish so that I can use a PVS template, either a putty or a bite impression tray, to make my temporary later. Being the dental school, we're going to be preparing this tooth for a crown in several weeks. In a dental practice, you'd place the core and you'd plan on preparing the tooth and making the impression the same visit. And so your procedure in your practice setting would be to anesthetize the patient, apply the dam, remove the former restorative material, amalgam in this case, finish your preparation, restore it with your core, the Fluorocore 2, using an adhesive technique, finish and polish it so you get your shape and your contours, do a PVS template, either a putty template or a bite impression tray, and put it aside for your provisional restoration. Do your crown preparation, rinse and dry, pack your cord, make your impression, then make your temporary. Take you from start to finish in a private practice, probably about 2 hours. Next visit, you're ready to insert the crown. Now let's take a look at an anterior case. This is an endodontically treated central incisor. You can notice that it's going to be very difficult to get a ferrule design on this tooth because it's pretty much broken down almost to the gingival line. We're going to place a fiber post, and when we fit and place a fiber post, we're using a large one because of the size of the canal. This is a tooth that was endodontically treated, and it was a very large root canal. We cut a fiber post using a diamond burr with water spray to size, and then we are going to cement the fiber post into place. This tooth had crown lengthening before we went in to place the restoration, so that we're going to place our core and our post before we send it for crown lengthening. Notice we've put cord in the gingival sulcus because how high the gingiva was up on the cervical of the tooth. I used a dual cure adhesive in the canal. I cemented the fiber post with the dual cure composite. I'm using a specialized matrix, and now I'm going in and placing my core. I'm going to use a natural color core material. I'm going to light cure my dual cure build-up material, and then I'm going to finish and polish it. I've done my core build-up, it's completed. We send the patient to the periodontist, they do their crown lengthening procedure. I go ahead and do my crown preparation after they've done the crown lengthening, pack my cord to make an impression, and then we will fabricate an all-ceramic crown. For posterior endodontically treated teeth, we can also use a post for auxiliary retention. In this case, it had a large composite already in place. The endodontics was done through the composite. You can see the access. When we remove the existing composite core, you'll notice there were some pins in place. We do everything we can to maintain these pins, as well as we're going to place a metal post for additional retention. We create our post space, and we're going to cement our prefabricated metal post. For this case, we use our adhesive in the canal, and we use the adhesive on the post, and we use the adhesive on the tooth. It can be an etch and rinse adhesive. It can be a self-etch adhesive. I'm using an opaque composite core material because when we do our crown preparation, we want to be able to see that our margins of the crown preparation are 1 millimeter to 2 millimeters beyond the composite core. So here we're using opaque dual cure composite. I remove the matrix band, and then I'll finish and polish the composite core, and notice I've created a shape to the composite core that's compatible with the shape that I want for my provisional restoration. I can make my PVS template, polyvinyl siloxane putty, or a heavy body tray PVS material in a bite impression tray. I'll put that aside. I'll do my crown preparations for an all-ceramic crown, keeping in mind that my margins must be beyond the composite core. Here we're looking at the crown preparation, and you can see on the facial surface that the angulation of the pin was not as compatible with a ceramic crown margin with a small modified shoulder. You can see the composite itself is easy to distinguish from the tooth structure on the lingual and on the proximal surface. I pack my gingival retraction cord and make my impression. I cement my provisional and I send it to the laboratory. The laboratory returns my all-ceramic crown and I cement it in place using a dual cure composite resin cement with an all-adhesive technique. So the key points: composite core buildups can be placed and prepared for crowns and impressions in the same visit. Dual cure and self-cure composites assure complete polymerization without concern for access to light curing. That's especially true in endodontically treated tooth. Know your adhesive. Certain etch and rinse adhesives and self-etch adhesives cannot be used with dual cure composite and self-cure composite core buildups. Follow the manufacturer's instructions. In the dental school, we use Fluorocore 2 with its companion etch and rinse and self-etch adhesive. Use a composite shade that doesn't match the tooth so you can differentiate the crown preparation margins from the sound tooth structure. So you must be on sound tooth structure. Composite core buildups material can also be used to cement posts. This was Dr. Howard Strassler talking about direct placement, cusp replacement, foundations, and cores using composite resin.